All right, so today I'm going to take you guys through a nice little lecture I like to call What's Wrong with This Picture? So mainly what we want to do today is try to identify any injuries we can see on an MRI and an X-ray mainly, since those are going to be most what we see in athletic training, but really just get a general overview of what it's like looking at imaging techniques, with our anatomy now that we're in upper extremity evaluation pretty heavily this semester. We want to take some time and see what are radiologists and physicians using that help us confirm the diagnoses that we see in the field. So let's briefly go over a couple different types of imaging. Everyone knows what an X-ray is by now. Really great for looking at bone. MRI, so magnetic resonance imaging. You can kind of see an example of this in the top right. So this is going to be better for more soft tissue images, and basically the two magnets in the coils will alter the atomic structure of molecules. And what happens is when that signal pops back, we can get a nice image. It's pretty science heavy, but that is basically the science of what allows us to look at MRIs. There are two different types. There's T1 and T2, and that kind of just plays with the contrast. So T1, you're going to see space and fluid as a darker structure, and that's exactly what you see here. So this is actually your anterior horn and lateral ventricle in your brain, and this is actually fluid filled with CSF. In a T2 image, this would actually be bright, and this would be darker in contrast. So we have ultrasound here. So not just looking at babies in the womb now, we can actually have been using ultrasound in certain clinics to look at soft tissue injuries. So here you have a little proximal phalangeal fracture, and this just orient you. So this is superficial. This is where the ultrasound head would be, and it projects image down using sound that will recoil back up, and that's how we get our image. And you can actually find the flexor digitorum profundus right here, and here's where that fracture piece came off. So it actually came from here, the distal phalange. And this is a pretty good picture. Ultrasound, I find it's pretty grainy. It's not that easy to identify, but it's something just to practice on, because this is going to become more and more prominent, especially since it's something you can do right away on the field, or just walk them right up into the athletic training clinic without having to send them out for an MRI or anything like that. DEXA, dual energy X-ray absorptiometry. Here we have an example. You would lay down and get scanned. Very, very similar technology to an X-ray, and it allows us to get an overall image of your bone density. And then computed tomography, similar to an MRI. The images look very similar too. This is just going to be typically used a little bit more for hard bone-like images. So we want to have something more accurate than an X-ray, and that we can scroll through similar to an MRI. That's what we're going to be looking for. So briefly, we just need to make sure we have our orientation right. This is going to be really important when we're trying to identify what we're looking at. So if you get something and you're not quite sure, is it right, is it left, or if we're speaking to other professionals, we need to be able to, say this is more medial to this anatomical structure, or this is more proximal or more distal. That just really helps healthcare professionals, especially when we're talking about specifics, know where exactly an injury is. If you're talking about something such as coming up in the first image, it's proximal to the elbow, or is it distal to the elbow? If they're trying to find a not obvious injury, it really helps to give those specific directions. Similar with directions we need to know our anatomical planes. So we have our coronal plane that cuts the body front to back. We have our transverse or horizontal plane that would cut you up top and bottom. And then we have our sagittal plane, which would cut you into left and right halves. So we're going to be wanting to use these because it's going to be part of the questions that you're going to be asked, but it really helps just frame the body in your head for when you're going over anatomy and mentally and trying to figure out what you're looking at in real time. Questions I like to ask, and we're going to practice these every time today. So what are we looking at? Is this right arm, left arm, leg, elbow, wrist, hand. Most of it today is just upper extremity. What plane is this? That's just good practice. What are my anatomical landmarks? So here we're trying to figure out, where am I looking? What can I easily identify just to help orient yourself? And then we can work our way out from there. Is this a carpal, a metacarpal, a distal phalange? That tells you a little bit of where you're at in the hand. So it kind of lets you know what should you expect to be able to identify. What is normal or abnormal? And that's kind of the big question here, is what's abnormal? And then anything else, throwing some extra credit in there. It's good to practice your anatomy. It's good to know your landmarks. So you really can't have too much practice with this. So first up, what are we looking at? What's wrong with this picture? So we can see this is a right arm. How do we know it's a right arm? We've got a nice R here, but if we didn't have that, what would be an anatomical landmark that we could see? We don't have any muscle. We do have this nice medial epicondyle right here that would kind of inform us that this is a right arm, rather than just having some symbol right here. And this is actually my arm from when I broke it. So this would be a mid-humeral comminuted fracture. We have 3 different pieces here. It's hard to tell. One thing with x-rays is that we always want to try and have a few different planes of imaging. So this would be what kind of image? Frontal, good. So we have a front half, back half. If I cut my arm in half right here, that would be an axial or transverse. And if I went right down the middle and cut it in front to back, that would be a coronal or frontal plane image. And that gets a little tough with the extremities when we're not looking at the whole body, big picture, but those planes carry right down through the extremities as well. Is there anything else you guys can identify on this? We have some shading right here. What could that be? It's most likely the hematoma forming. So you can see some skin. It's clearly the most outer border of my body. And then we'll most likely have fat. And what x-rays are really good for are just bones. You're going to get that shading, and that's most likely going to be blood that's impacting the image, or very, very dense fat, which is, that still provides some density, but you're not going to see as much. This is just for orientation for the shoulder, because I know it's a little tricky, but try to remember that these are all the landmarks that we can readily identify for the next image. All right, so what's this right here? Same thing right here. Yeah, that's your humerus. And it's hard to get MRIs from Google because most of them have them labeled already. But we have this. If we know this is our humerus, this would be our glenohumeral joint. So then what would this be right here? Yeah, it's your labrum. Good. So labrum, and this is actually a slap tear. So what we see here is this was an MR arthrogram where we actually injected a contrast dye that would allow us to see a little bit better into that space. You don't have much definition right here. And we can see clearly that it highlights there's a gap here. And sometimes you can actually see the fluid leaking out that it's not supposed to be. It's supposed to be in a closed capsule. Good. This is a nice one. This is an X-ray, clearly. So what are we looking at? Right arm or left? Right hand or left hand? Good. What plane would this be in? Frontal. And this is the left hand. And we know this how? Well, here's the thumb. And we can see the wrist. It's hard to tell, if they're supinated or pronated with their hand, but we know that this large bone right here is the scaphoid. So if that's on the medial side, then this is likely the left hand. If I move this, it would be the left. So, and then that goes my anatomical landmark. The thumb in general helps. What's abnormal with this image? This is tough. There's actually nothing you can see wrong with this image. And so what we did is we took an oblique view, which means it's just not really in one of the 3 planes that we talked about. And this is from a soccer player. And if you look right up here at the middle phalanx on the 3rd and 4th finger, you can see a bit of a fracture right there at the base and a bit of a fracture right here at the base. It's really tough to see. And that's why I mentioned we need to have 3 different planes of motion, of imaging. Anything else? I don't think there's anything else here. And then lastly, what do we have here? What type of image? Yes, the MRI, good. And so we've got what plane? Again, frontal. And do we have anatomical landmarks here? Do we know if this is a left or right hand? So we've got thumb. We've got ulna and radius. So this is likely the right hand. If I put myself into anatomical orientation where I'm supinated, ulna's on the inside, it'll be much larger. Radius rotates with the thumb. And so what are we missing here that I showed you guys from the last image? Big break right here. So what type of image, what type of abnormality is this? There's a scaphoid fracture, nice. Pretty significant, pretty concerning, but that's something that's really detected better on an MRI. So good, this is your homework today. I want to take you guys through this. Take me through this image and go ahead and answer all of these questions. And for extra credit, try to identify at least 10 to 15 structures. We have a great, and if you guys have this link, PowerPoint, if you click on this link or on these images, it'll take you to this website called Radiopedia, and you can actually practice scrolling through these images just like if we had real MRIs. They have different cases, so it'll tell you, this is a wrist from 6 months ago, 35-year-old female, and it'll often give you a brief radiology report telling you what they see or what they identify so that you can help practice that too. All right, I'll stick around for questions, guys, but have a great one.